this is speech number 3 for Joe Zuberick's speech class. Today I'm going to be talking about physician-assisted suicide. When you think of disease, the first thing that comes to mind is if there's a cure or treatment. With a terminal illness or disease, although there may be treatments, there is no cure, no chance of surviving. Imagine your last days of life laying in a urine-soaked bed, not being able to move any body part except for your eyes and gasping for breath. Would you want to live your last days of your life exactly like this? For those who have been diagnosed with a terminal illness, there is such a thing called physician-assisted suicide. Physician-assisted suicide, also referred to as PAS, is a practice when a physician provides their patient with a lethal or deadly dose of medicine with the intentions to end their life, upon the patient's request, of course. PAS is a highly argued debate between those who believe it is wrong and those who believe it should be legal. I'm here to tell you that people have the right to live and die having a life of dignity. Therefore, physician-assisted suicide should be legalized throughout the United States. Before we get into much detail, it is important to realize that PAS is not euthanasia. Euthanasia is when the physician acts directly when administering lethal doses of medication to end the patient's life. PAS is when the physician provides a prescription to the patient for them to administer themselves. There are also many other practices that should not be confused with PAS, such as terminal sedation, withdrawing or withholding life-sustaining treatments, and the administration of pain medicine. In order for a physician to accept the PAS request, the patient must already be diagnosed with a terminal illness. The physician also needs to evaluate the request. They must determine the nature of the request, clarify the cause of suffering, evaluate the patient's decision-making capacity, and also take into consideration emotional factors. Once the patient has been evaluated, and if they have a valid reason for PAS, the physician must go by the request of their patient. It is federal law for the right to palliative care. However, the federal government does not endorse PAS. The only United States state that has legalized physician-assisted suicide is the state of Oregon. Known as the Death with Dignity Act, Oregon's law allows terminally ill adult Oregon citizens the right to obtain and use prescriptions from physicians for self-administering lethal doses of medicine. The law has been very successful since the law passed in 1997. 401 patients have died under the terms of the Death with Dignity Act. In 2008 itself, 88 prescriptions were written under the Act, and those who participated were between the ages of 55 and 84 years of age. There are many reasons why a person with a terminal illness would want to end their life so quickly. According to American Academy of Hospice and Palliative Care Medicine, those who are dying face pain, depression, loss of sense of self, loss of control of dignity, fear of the future, and being a burden on others. What would the quality of life be if you sit in a bed all day waiting to die? Statistics show that 67% of doctors throughout the United States have received requests for PAS. This means that over half of patients living with a terminal illness around America would rather utilize physician-assisted suicide than suffer through their dying days of life. It is unfortunate that less than 10% of internal medicine training programs, including supervision and treatment of dying patients who are receiving palliative care. It is sad to think of the amount of people who suffer at the end of their lives and are not even taken into consideration. There is a group called the Study to Understand Prognosis and Preferences for Outcomes and Risks of Treatment, which investigates end-of-life care in acute care facilities. This group is on the rise and collaborates to collect needed statistics and information necessary to provide good quality and many options for end-of-life care. Statistics collected by the support group show that 50% of patients who died had moderate to severe pain at least half of the time during their last 3 days of life. This information is taken from those who died suffering from terminal illnesses in hospitals. What this shows is that the very last days of those with terminal illnesses are very painful and full of suffering. Although some may say there are alternatives to PAS, such as pain medicine, how much quality of life do they have by lying there without any knowledge of what's going on? Not only is this a dignity issue, you also need to consider the family that surrounds the patient. What would they really want to see their loved one in this predicament? Physician-assisted suicide is its own practice. It is not to be compared with other practices such as euthanasia. There are also many rules and regulations that go along with passing a PAS law. The physician needs to evaluate the request and determine if there is a valid excuse or not. The federal government endorses palliative care but does not endorse PAS. There are many reasons why PAS should be legalized throughout the United States, and there is evidence in the statistics that are shown.